Good morning, good morning. It is Gratitude Monday. For those of you who might not know me, my name is Dr. Jeanette Witt. I'm a physical therapist, an athletic trainer, and a fitness nutrition specialist. And I know that I've received some friend requests, so some people might be new to hearing me, but I am coming on a little early today because I am excited about starting my day. But the thing I am most grateful for today is health. So for those of you who don't know me really well, I've had some health scares. And in this time of the coronavirus and the pandemic and the safer at home orders, a lot of people are feeling uncertain about what is going to happen. A lot of people are feeling scared. A lot of people are just flat out afraid that it will happen to them. And for those of you who are directly affected, meaning you or someone you know close to you has COVID-19, my heart goes out to you. It is a terrible, terrible virus. I've had a friend of mine in a business community 16 days of symptoms, and she doesn't live locally to me, but just hearing her story and the experience of it is just awful. There's an article in the paper yesterday about a girl, a local girl from UW-Madison. I think she's from here in Kenosha, but she told her story. And in both her situation and in my friend's situation, they both described the feeling like they were going to die. And that is how serious this COVID-19 thing is not to be taken lightly. As a healthcare professional who is still treating patients, who is screening patients every time they come in the door, who has converted a lot of her patients over to telehealth, I am telling you this is a serious thing, and you should definitely be following all the rules that are recommended by the CDC. And saying that, good morning, Nancy. Good morning, Judy. I appreciate you coming on today and listening. And saying all that, I am super grateful that I have my health, because I have had moments where my health hasn't been the best. I look back and I remember in 2001 when I had mononucleosis. To get mono as an adult, I think I was, 2001. I don't know how old I was. I was in my 20s, mid-20s. But I'd been training for a lot of marathons. I was exercising a lot. I really wasn't eating the way I should. I thought I was eating healthy, but I didn't really know what I was doing. So, good morning, Kevin. Good morning, Nicole. And I didn't really know what I was doing when I was training for marathons. So I was just burning myself, burning my body, crashing it to the ground. And over about 9 months, I finally got the diagnosis of mononucleosis back in 2001. And it was so bad that I had these golf ball lumps on the back of my head. I couldn't lay down on my back because these lumps were there and they were so painful. And that is actually what sent me to the doctor. Good morning, Erica. Thanks for tuning in. And when I went to the doctor, I had already been tested for mono, and it was negative. So I didn't know. I really wasn't expecting mono. I didn't know what to expect. All I knew is that I had these lumps on the back of my head. Well, those lumps were my lymph nodes. They were so swollen, and I actually had like 102 fever. And I did test positive that time for mononucleosis. I ended up missing work, like a couple of weeks of work, and then I could only go back half days because I just had no energy. And the worst part of it was I was hallucinating. And I lived in a 2-family apartment building that my dad and his brother owned. And my sister lived on the bottom floor, and I lived on the top floor. And our rent actually went to help pay for my grandmother's Alzheimer's care. And that was helpful for my grandmother, But what happened was, because my dad owned the building, I kept thinking he was coming into my apartment because I was hallucinating. I was sleeping like 16, 17 hours a day. And then I kept thinking that somebody was walking in. And so I called him and I said, Dad, stop coming into my apartment and checking on me. I'm fine. And he's like, Jeanette, I'm not coming in. What are you talking about? And I'm like, you keep interrupting my sleep. He's like, I'm not anywhere near the apartment. And your sister's at work. Nobody's coming into your apartment. So that's how sick I was. And I remember coming out of that. I remember that I couldn't work out. I remember that my spleen was not swollen, but I wasn't allowed to do any sit-ups. I wasn't allowed to exercise. And I was basically quarantined in my apartment. Good morning, Liz. Thanks for tuning in. And it was a self-quarantine because I had no energy to go anywhere. And when I started to come out of that, I really, really appreciated how long that it took. I was so deconditioned from being basically either on the couch or in bed for 2.5, 3 weeks that it was just very memorable. And I knew at that moment that I was going to have to make some changes. And so I ended up working with a dietitian. She was also an athletic trainer. She helped me learn how to actually train for running events or long distance running events, to work on my food, make sure that I was eating enough for the amount of energy I was burning. And I fully recovered from that. But one thing that didn't change was that prior to that, I used to be able to get by on about 5 to 6 hours of sleep. And then after that health scare with the mono, I needed like 8 hours of sleep. And good morning, Matthew. Matt, sorry. I see Matthew pop up, but hey, Matt, what are you doing? And what I learned from that was I needed more sleep. And I needed to rest, and I needed to take time to take care of myself so that I wasn't constantly getting sick and that I wasn't at risk for getting other people sick. Well, now with the whole COVID-19 thing, I'm certainly not comparing my experience with mono to COVID-19. COVID-19 is its own beast. I mean, this is nothing to even laugh about or make fun of or take lightly. Mono was definitely a wake-up call for me. COVID-19 is like on another level. And I am so thankful that I have not had that or been exposed to it. Good morning, Scott. Thanks for tuning in. I appreciate you. Hoping that you and Amy are doing well. And I am so thankful that my family is healthy, that we are safe, that we are abiding by quarantine. I even, as a healthcare provider, I actually don't have a mask, but I made one last night because I have to go out in public today. And I have a few patients coming in. I screen them, I take their temperature, and, I treat them. And anybody who comes in, if they have any type of symptoms, they are sent home and don't even come back into my treatment room. Good morning, Jody. Thanks for tuning in. And so I'm really, really cautious. But now they're recommending that you wear a face mask anytime you're out in public, whether you have the symptoms or whether you don't. So I made a face mask last night. Good morning, Shauna. Good morning, Janet. Thanks for tuning in. And so I took a bandana and 2 hair ties from my daughter because, my hair is getting long because I haven't had a haircut, but it's not that long that I need hair ties. So I borrowed some two hair ties, made up this bandana, folded it, used the hair ties to put behind my ears. And maybe later when I go out, because I have to go to the grocery store again just to get some milk, maybe I'll put a picture of myself on Facebook and show you my bandana handmade, homemade face mask. But I am so thankful for health because it's so easy to take it for granted. I'm so respectful of my patients, because when people come to me, let's face it, I'm a physical therapist. When people see me, they're not at their best. That's why they're seeing me. They need me to help them get better. And I respect that. I don't take that for granted at all. It is such a privilege to help people feel better. Yet at the same time, sometimes I neglect what I need to do, and I forget to take care of myself. And it's so important. It's such like the stewardess on the airline, or on the airplane. And Janet says she wants to see my mask. Okay, I will try my best to remember to put the mask on and take a picture of myself before I go into the grocery store. I will do that. It'll be later though, because I'm at my office probably until 5 p.m. So it'll be later. But what was I saying? Janet, you're so funny. But we had to take care of ourselves, and health is such an important part of your life. Like, if you don't have your health, what do you have? What do you have? Thank you, Janet. Thank you so much. I appreciate that. She said I'm an amazing PT. I appreciate that, Janet. If you don't have your health, then you can't do what you need to be able to do, and you can't do what you want to be able to do. And that just doesn't make for a high quality of life. I have patients right now who wish they could walk more than 5 minutes. Can you imagine that? How do you take that for granted? If you're out going to the park right now and you can get out of your house, out of the quarantine, and maintain social distancing and walk for 30 minutes, there are people right now who cannot do that. Do not take that for granted. If you want to go out and ride a bike, there are people who have balance issues. They can't do that. Do not take that for granted. If you can get out of bed and put your clothes on yourself, do not take that for granted. There are people who cannot do that. The number one thing for me is my health. I talked about mononucleosis. I went through another time where it's really, really stressful because of my work schedule and my husband's work schedule. And I was really running myself down, and I had to check myself and reprioritize what I was doing because I was burning myself into the ground again. So I made a lot of adjustments. If you are stuck at home right now, and you are not a healthcare provider or considered an essential business, but you're stuck at home, use this time to reflect. I know Janet Ruffalo, she had a great post over the weekend about her reflection. And there was a picture of these circles, and you had the choice to kind of stay in the negative, or you had a choice to grow. This is a time to grow. Like, what are some things that you can do now to improve your health so that you reduce your risk of being exposed to COVID-19 or to any other disease for that matter? If you're not sleeping, if you're not eating well, if you're not exercising, if you're not taking care of yourself, you are more at risk to getting sick. Good morning, Shelley. Thanks for coming on. You're more at risk for getting sick. Use this time where you're staying at home to start an exercise program. Use this time while you're staying at home to recalibrate your food choices. Use this time at home to make sure you're getting enough rest. Those are the 3 biggest things that you can do besides washing your hands and keeping your hands off your face to stay healthy. Good morning, Melissa. Thank you. Thank you, Shelley. You have morning sunshine. Shelley has the most coolest posts. She takes pictures of sunrises in the morning, and they are absolutely breathtaking because she lives off of Lake Michigan, and she gets to see the sunrise off of the lake. It is so cool. So check her posts out because If you want some great nature pictures and see and how God blesses us every day with sun and a sunrise, her posts are fabulous. But anyway, I'm going to get going here because I got some patients who are coming in a little bit. But I just want to come on and say I am so thankful for my health. I pray for each and every one of you. My heart goes out to you if you are sick, whether it's with COVID-19 or the flu that's still going around or sinus infections. I've seen some friends of mine who don't have COVID-19 but who are battling some other illnesses, or their kids are battling illnesses. And I just pray for each and every one of you that your health is at its best. God bless. Take care. And I will try and remember to post that picture of the face mask that I made with a bandana. I'll see you later. Take care.